In this video, I'm going to show you how to create separate incidences for patients. So this started with Medicare a number of years ago. Well, Medicare really wants us to treat the Medicare beneficiaries in terms of incidences or episodes. Well, now the whole rest of the healthcare universe wants the same thing. So it makes it actually easier for us to keep track of each incident or episode for a patient. So we'll be able to do that quickly and easily inside the program. For a regular patient, that would include for active care. So that would be a cash paying patient, Medicare, regular health insurance. If it's a PI, workers' comp, or slip and fall type of case, or even a maintenance case, we're going to create a separate incident for each of those. So I define maintenance as asymptomatic wellness. In other words, if you have a patient who you're seeing on a regular basis, maybe once a month, a couple times a month, but they're not asymptomatic, it's mainly for long-term pain management, chronic pain management kind of a thing. I'm going to consider them a regular incident because that way I'm going to be able to document the intensity and frequency of their symptoms, even if it never changes. Maintenance, again, I'm going to reserve that incident for an asymptomatic wellness patient. To begin with, we're going to log into the program with our username and password. And we select the patient, click on New Incident, and come down to Treating Clinician, and go to the three dots to the right. This is only on the first time you go into the program. Click on your name, your credentials, and then click on that blue link there and say yes. And that will bring in your name as treating clinician all the time. So you just have to do that on the first time you enter the program. For, let's say this is a regular incident. If you want to, you could describe it. Maybe this is lower back, and hit save. And maybe we click on a new incident. And let's say this is still a regular. Maybe to give this another description, neck and upper back. This is only optional so that you can take a quick look and see which incident you're dealing with. If it's a personal injury case, if you want to, you can put the date of the collision in there. Just kind of keep it straight for yourself. Let's say there's a different patient, click a new incident. You'll see that the treating clinician's name already shows up in there. Let's say this is maintenance, and save. That's all you got to do. And then once you finish with that, you would come over and click on New Visit, and we're off to the races. If you have any questions about setting up a new incident for a patient, just email me at Dr. Greg, spelled with 2 G's at the end of Greg, at thebulletproofchiro.com.